Hi, this is Jessica DaMassa with WTF Health, and I am here at Webit in Sofia, Bulgaria. And joining me right now, I have Matt Lowe. He is the founder and chief executive of Performance.io, and he is working to change the way that pharmaceutical companies sell their wares. So talk to me about reshaping performance in healthcare.
I feel like I've made it. It's the Jessica DaMassa podcast interviews. It's fabulous. I think what you're doing is brilliant, and I think it gets to the
Flattery will get you everywhere.
All right, that's good. We'll work on that throughout. But I do. I think watching the people you interview and their opinions needs to transcend what is actually happening in big pharma. I've worked in big pharma, small pharma for 17 years. I've worked in agency side. And from being a sales rep back in the day, I think, it's a real privilege working in healthcare, getting to speak to healthcare professionals for 10, 20, 30 minutes around solutions that can save people's lives is great. But the vernacular, sales, representative, kind of jars with what's going on right now in patient centricity and providing information for patients that's actually valuable. And I think that is where we are trying to redefine performance in healthcare. Okay. So drug companies...
So death to the sales rep.
No, I get this a lot. Like Accenture and Ernst Young are like, no, sales reps are very important. We make a lot of money from sales reps and the models we sell pharma. Yes, I think that's antiquated. But I think, as someone who held the product-related costs, the budgets, who put work out to tender, our best asset is always a well-informed human being. That's period. Sure. But actually, understanding the way human beings engage and seek information is fundamental, and it's not with a sales rep, and with doctors predominantly it's not with a sales rep. The first thing that every single one of a drug company's audiences, patient, doctor, carer, nurse, physician, mother, father, daughter, does when they need information is go to a search engine. Yet, how many drug companies globally have a well thought out, congruent search engine marketing strategy? Not one. Not one. To routinely ignore the first step in every single one of their audience's user journey and the vast and useful empirical data sets that information yields around behaviors, around needs, around anxieties, around support is nothing short of bizarre. So Performance.io, we launched the industry's first end-to-end online performance marketing agency. We look at everything in this space, from domain strategies, URL hierarchies, semantic search terms, social, universal search, conversion rate optimization, landing page optimization, all of these aspects which routinely, currently in pharma and healthcare, do not exist. So that wasn't that concise, but it gives you an idea of what we do and how we're trying to redefine.
No, I love that. I'm lost, and I want to know, how are you currently defining performance? How is the industry defining performance, and where are you trying to move that definition to?
That's a great question. It's quite nebulous, I guess. Performance often defined by financial results, the chief executive's financial report and yearly annual report. We're not trying to stop people making money. I think defining the purpose of healthcare and understanding the objective of pharma is very important. The purpose is to provide healthcare solutions. The objective is to make money. If we focus on the purpose, we may achieve the objective. If we focus on the objective of making money, we're missing the point. But pharma companies need to be successful. They need to be cut some slack because they provided innovation in R&D that provides solutions. But routinely for decades, that's yielded billions of dollars of profits. Shareholders are very happy, and the model hasn't needed to change. Now, with thousands of citizen scientists, people who don't need a laboratory to synthesize a compound, they can do it with access to the web and research and AI and progressive technologies, and big digital companies like Amazon and Samsung and Apple getting into healthcare, pharma kind of sits in the middle, and for the first time in decades, it's almost being forced to change, which is fabulous. It's being forced to understand how it provides value beyond the pill, patient-centered design, patient-led design, useful information for healthcare professionals. So what we're trying to do is maybe take a little bit more of a consumer approach to understanding audience needs, providing relevance to customers, whether they be healthcare professionals, pharmacists, or patients, and using all those empirical data sets to redefine performance by looking at things like acquisition, leads, conversion rate optimization, landing page optimization. There's nothing wrong with aggressively trying to help a patient through to a solution. Right. And I know it's very different in North America. We have direct to consumer. The rest of the world, we have, we can't provide information directly to consumers in the branded space, but those disciplines are fundamental to providing relevance, to being relevant. So that's what we're trying to do in redefining performance.
So Matt, tell me, from where you're sitting, is the pharmaceutical industry ready for this?
It's a great question. When I launched my first company in this space, it was either bang on time or too early. It wasn't too late. No one else has done this before. In pockets it's done, but what's routinely happened is creative agencies or policy agencies or comms agencies have done a bit of performance. You wouldn't get your plumber to do the electrics in your house. You need deep industry experts in performance marketing disciplines to help pharma redefine performance in this space. The ambition is there. I've heard many times. The companies around us, Jessica, Astellas, Amgen, Novartis, pretty much every one of the big pharma companies we work with, we hear from all of them we are patient-centric. I don't doubt for a second that each person in pharma isn't patient-centric. Of course they are. They care about patients. But holistically, it just takes one semantic search, a fraction of a second on a search engine to show that pharma don't exist where people go for information. Whether it's ready or not, yes, because we have audiences and partners in pharma collaboration from C-suite down who are looking to drive change. Sure. Is it easy in pharma? No. It's very nebulous. Decision by committee doesn't work. It's embedded in this model which has been sales rep led, and these disciplines and skills don't exist. I'm talking later, and I was with the Chief Digital Officer at GSK last week, Chief Data Officer of Sanofi, Milan, a great friend of ours, and the likes of Eugene. There are people who get it. There are people who are looking to drive change. They're trying to pull an organization with them that doesn't have the skills or the behaviors and the core competency framework that lends itself to driving that change. And with this meeting last week, I said if you wouldn't get a job at Expedia if you didn't understand performance, if you didn't understand conversion rate optimization, landing page optimization, cost per acquisition, domain strategies, URL hierarchies, data. We're not selling holidays, we're saving lives. And so it's absolutely fundamental that the industry addresses it. Whether they're ready, hand on heart, we don't have years to convince them that search engine marketing or performance is a thing. Google have done that very well for 20 years now. What we are looking for is willing partners who want to provide value to their audiences across the spectrum, relevant information, and then tailor that information. And that is not the antiquated closed-loop marketing and customer relationship management systems that exist in pharma today.
All right, man. Good luck with that. That's a very ambitious journey ahead of you. No, but one that needs to be taken. And so, thanks for
that's okay.
for heading out upon and embarking upon that for all of us.
No,
we certainly appreciate it.
We're having fun.
Wonderful. Well, Matt, it's a pleasure to speak with you. I'm Jessica DaMassa for WTF Health here at Webit in Sofia, Bulgaria. Thanks so much.